Hi, Jeremy.
Hi,
How are you today?
I'm doing well.
Good, glad to hear it. So we're going to be doing a skin assessment, face mapping, and some light therapy on you today, correct?
Yeah.
Awesome. So let's start by just taking a look at your skin. Just doing a visual inspection here. And do you have any issues with your skin? Any excessive dryness or oils production, anything like that?
Yeah, sometimes a little dryness.
A little dryness? Okay. Keep an eye out for that. Before I touch your face at all, I'm going to go ahead and do a light inspection. Close your eyes for me. And I'm just going to take a really deep look at every part of your face with this light. And I'm just checking for any freckles, nevi that look concerning, as well as any spots of dryness or excessive oil that would lead me to believe that there's something going on with the section there, the pores. With face mapping, we split the face up into different sections because your skin is different along your entire face. You have different zones that are going to result in slightly different types of skin. And I'm seeing that there is a little bit of oiliness on the nose and around the ridges of the nares, and that is normal. It's part of what's called the T-zone. As well as some dryness around the eyes. Do you have any tearing when you get tired or just due to allergies or anything like that?
Sometimes, yeah.
Okay. I find often with my patients that in the cool weather, that can definitely happen as you start going outside and your warm body is hitting the cool air. It can produce some tearing. Turn your head to the side here. Doing okay?
Yeah.
I am noticing just a little bit of scoring here. Looks like you might have had that injury quite a long time ago.
Yeah.
Okay, so we can do a little bit of light treatment on that too to try and reduce the scar look there. And just a couple of nevi here and there, one right at the top of the head that I'm noticing. Bottom of the chin looks good. Go ahead and look forward for me. I'm going to take a closer look now. I'm just going to use my magnifying glass. And I'm just examining those couple of spots that stuck out to me. Just take a look at this one nevi here. And again, there's going to be a bright light, so just keep your eyes closed. Okay. So that is looking pretty symmetrical, pretty small, even borders. See another little scar right up here. I want to focus a little bit of the light therapy on that. Turn your head gently for me. I'm not seeing too many ingrown hairs. Do you ever have any problem with that in your beard?
No, not really.
Okay, excellent. And just checking the scalp where the hair meets the face here. Turn the other way from the face. There we go. And same thing on the side, looks really healthy. Just those couple of spots that I noticed. There's one nevi there that looks a little bit irregular, but it's not raised or anything like that. Okay, alright, great. So go ahead and turn forward here. So I'm going to start the face mapping. I'm just going to put on some gloves for that. I don't want to touch your face with any of my oils on my hands. And what I'm going to do is break up this face into sections. There's going to be 2 sections along your forehead, your cheeks, your chin, and your nose. And to just separate that, I'm going to just draw some dividers here, okay? And then we're going to go ahead and test and treat each section. And I'm also going to be looking at your chin. However, because you do have a beard, I'm not going to draw in that section, alright? I'm quickly just examining the eyebrows and the eyelashes while I'm here, and the eyelids. First thing I'm going to do is just check for oil in each section. I'm just going to be blotting each section, and your face is unwashed, correct?
Mm-hmm.
Okay. And do you use any products on your face?
No, not really.
Okay. I'll just label that section 1. Sorry about that. Try that again. I'm definitely seeing the most oil production on that nose and that T-zone in section 6. So I'm going to start with focusing a little bit on that. So I do see that the pores are quite large compared to the rest of your face, where it's pretty smooth and you're not really seeing the pores. I think I'm going to do some red light therapy. I want you to close your eyes, and I'm going to grab something to just put over your eyes gently, okay? Just place this gently over your eyes, just to protect you from any harm. Lift your head up for me. Okay, you can set it back down. Does that feel okay?
Mm-hmm.
And we're just going to be focusing the therapy on that nose section here. And the red light's really good for calming pores, helping healing. We'll be using this a little bit on those scar sections too, and really help reduce swelling. It might be getting a little hot. Do you feel a warmth?
Mm-hmm.
Let me know if it's too much. Give just a little blue light as well. And this can help shrink your pores. Heal some of the scarring here that could be from pimples and issues like that. Did you ever have acne as a child?
Mm-hmm.
Okay. Yeah, I'm definitely seeing a little bit of acne scarring. Nothing too disruptive to your skin, but we can help reduce that. While I have this, I'm actually going to take a look at the little bit of scarring I saw over here and tackle that as well. just moving in sections here, up and down, targeting the issues. Don't want to stay in one place too long. That can be very intense for the skin. Bring that red light. I'll take a little break there and let the skin relax and recover. I'm going to a little bit of green light around the beard area. And we're just going to promote the healthy growth. Your beard looks really healthy, but we just want to make sure that we're not getting any ingrown hairs. The hair is coming in evenly. The color is evenly distributed as normal. And that you're not getting any redness and dryness underneath the beard. Just getting down into the neck here. I'm actually use this right in the hairline as well, just a little bit. Same reasoning. Encourage follicle growth, making sure that the hair is coming in evenly. Doing okay so far?
Yeah.
I'm just going to do a little bit more here. I'd like to focus on your cheeks just a little. And your cheeks are honestly in very good shape. I just see a little bit of swelling and puffiness. So I'm just going to get a slightly different variation of the red scale. It's got a little more pink to it. And we're just going to sort of try and attack that swelling, puffiness, bring that down. Should give you a little bit more definition in the face as well. I'm going to sculpt the jawline a little bit as well with this. Last thing I'm going to do is just a little bit of orange on your lips. Just promote some collagen production. Keep them nice and moist. I'm going to gently do this on your eyes as well in just a minute. Okay, keep your eyes closed. I'm just going to remove this slightly. And I'm going to very, very briefly do this over our eyelids and try and attack some of that dryness you've been having from the tearing. And just keep your eyes closed gently, but keep them closed. And I'm just making quick passes. Don't want to overwhelm the eyes. Okay, good. Right, and slowly blink open your eyes, Jeremy. Doing okay?
Yeah.
Wonderful. Just going to go ahead and remove the sections now, cleanse our face. This is just a super gentle cleanser just to take off the markings and to also clear out any oils that may have come on your skin while I've been doing the procedure. Alright, Jeremy. So, I think that's going to be your session today. Let me just take one last look at your skin, just with a magnifying glass. You should start to see some of those light improvements from the light within a few 24 to 48 hours. If you have any sort of reaction, any redness, itching, swelling, please let us know right away. It is kind of an intense treatment, so it can result in some issues, but I think everything looks great.
Perfect.
Thanks for coming in today.
Thank you.